A black female doctor is looked down upon and treated like a janitor in an hospital. Despite her years of training and expertise, she is dismissed by colleagues who underestimate her based on her race and appearance. But when a life-or-death emergency arises, she steps up without hesitation, proving her worth. Watch as her leadership in the operating room transforms her perception and the respect she rightfully deserves. Stay tuned and watch the story unfolds. Dr. Jasmine Lee stepped into the busy hospital corridor, her scrubs crisply fitted to her frame, stethoscope resting casually around her neck. She exuded quiet authority, every inch of her body carrying the weight of years of training, study, and unrelenting hard work. Yet, as she walked down the hall, she could feel the eyes of the medical staff on her. Her footsteps echoed through the sterile air, but instead of recognition or respect, the hallway was filled with the scent of antiseptic and the whispers of dismissal. A nurse, without meeting her gaze, walked by and thrust a mop into Jasmine's hands. "Clean up room 4, please," the nurse said with barely a second glance. Jasmine paused, her fingers tightening around the mop handle, a flash of disbelief rippling through her. For a brief moment, her mind screamed to respond, to correct the assumption that had been made, but she took a deep breath. She was used to this by now. The assumptions, the dismissive glances, the belief that she was just another cleaning staff member. Despite the weight of her credentials, she was often seen through the lens of bias, reduced to a role others believed fit her appearance rather than her abilities. She didn't argue. Instead, she nodded, accepted the mop, and moved forward, refusing to allow the sting to show on her face. Her hands moved with purpose as she walked down the corridor, her badge visible but ignored. A whisper fluttered by her ears. "She must be new. They let cleaning staff wear scrubs now," one nurse muttered to her colleague. Jasmine caught the words, felt them like a blow to the chest, but kept walking, determined not to let the words derail her focus. She'd heard it all before, during her med school days, in the halls of her residency, even in grand rounds. Not everyone says it out loud, but Jasmine had learned that sometimes silence speaks louder than the words ever could. As she approached the surgeon's lounge, she hoped for a moment of peace, a brief respite before her next surgery. The door was slightly ajar, and she entered quietly. Inside, a group of doctors were engaged in conversation, but none of them looked up. Their chatter was filled with the usual medical banter, mixed with the casual condescension she had long grown accustomed to. A young intern, standing against the doorframe, noticed her and shot her a smirk. His arrogance was blatant, the kind that came from someone who had just started but thought they had already earned their place. He looked her up and down with dismissive eyes before his mouth opened. "Wrong door, lady," he said, a cocky grin spreading across his face. Jasmine stopped for a split second, her gaze locking with his, but there was no flash of anger, no confrontation, just stillness. She said nothing, simply turned the handle of the door and walked past him, letting the remark hang in the air, like a joke that had missed its mark. She could have responded, but she didn't need to. She didn't need to prove herself to him, or to anyone else. Inside the lounge, the silence was suffocating. The few doctors who had noticed her entry barely acknowledged her presence. She overheard one of them mutter to another, barely disguising their sneer. "I guess janitorial staff is getting nicer uniforms now." One doctor chuckled under his breath, as if Jasmine couldn't hear it. Jasmine didn't react. Instead, she walked to her locker, retrieved a binder filled with detailed surgical notes, and opened it. The aortic valve surgery she was about to perform was a high-risk operation, one requiring precision and expertise. She had spent the past 48 hours reviewing every aspect of the procedure, every potential complication, every step. She knew the anatomy of the heart like the back of her hand. The operation would require skill, calm, and concentration. It would require her expertise, but she wasn't sure if her colleagues were aware of that yet. Her hand reached for the coffee machine, her body moving with practiced efficiency. As she filled her cup, she steeled herself for what lay ahead. Her mind was clear, focused solely on the patient. But just as she was about to turn and leave, A crumpled paper towel flew across the room. It landed at her feet, tossed carelessly by one of the doctors who hadn't noticed the small mess he'd left behind. He didn't apologize, nor did anyone else. It was a subtle reminder, yet another small indignity in a day filled with them. Jasmine didn't pick up the paper towel. She didn't owe anyone that. Instead, she moved around it, keeping her eyes focused straight ahead. She wasn't here to clean up after people. She was here to save lives. She didn't need to explain that. She didn't need to prove it. Dr. Halpern, a senior attending physician known for his respectability, glanced up from his work. His gaze met Jasmine's for just a moment, and something flickered in his eyes, a flash of recognition. But he quickly looked away, closing his mouth without a word. Jasmine had worked with him before, but it wasn't the first time he had chosen to stay silent. Even those who knew her often hesitated to speak up in a system that still treated her like an outsider. Jasmine checked her watch, noting the time. Surgery in 20 minutes. She adjusted her scrub cap and took a deep breath. The next patient was waiting, and she couldn't afford to waste time on the ignorance of others. She stood tall, shoulders squared, chin slightly lifted. Not because she wasn't affected by the judgment around her, but because she had learned long ago that dignity is often born from restraint. There was no need for anger, no need for confrontation. The whispers, the dismissals. They couldn't touch her. Not today. She would let her work speak for itself. And soon they would all see. The sterile calm of the hospital shattered with a sudden urgency. A high-pitched, shrill alarm pierced the air, the unmistakable call of a code blue. Jasmine's body tensed at the sound. A life was at risk. The overhead speakers crackled with the announcement. Code blue, room 312. Stat. The moment the words echoed through the hospital corridor, everything changed. The calm that had settled over the building evaporated. Nurses, doctors, and staff surged into action, but a quiet panic began to spread through the halls. The rapid rush of footsteps was replaced by a collective pause of uncertainty. Jasmine stood still for a moment. Her heart raced, but her mind was already focused. Her hands itched for action. She knew what was needed: precise action, clear direction, and the confidence to steer the situation. But she was all too familiar with how the chaos in these moments could paralyze those who lacked composure. She didn't wait for anyone else to act. She stepped forward into the storm, and as she walked, her senses sharpened. She could feel the tension in the air, see the fear in the eyes of the staff, and hear the collective murmurs of panic. A nurse scrambled to pull her gloves on, a doctor shuffled papers, and a couple of other residents looked uncertainly at each other. The intern who had mocked her earlier stood frozen, unsure of what to do next. His face flushed, his smirk gone, replaced by confusion. Jasmine passed him without a word, but he was keenly aware now of the weight of his earlier dismissiveness. "Who's on call?" someone asked in a tight voice. "Dr. Singh," a nurse replied, her voice shaking, "but he's off-site, and it will take him at least 15 minutes to arrive." The seconds felt like hours. Time was slipping away from them. "That patient doesn't have 15 minutes, another voice called out in panic. The urgency was tangible now, cutting through the hospital like a sharp blade. No one wanted to step up, yet all knew they couldn't afford to wait. The room was paralyzed by indecision and fear. Then, as if cutting through the tension with a sharp scalpel, Jasmine's voice rang out. "I can." She stood in the doorway, her posture relaxed but radiating authority. Her voice was calm, yet it carried the weight of certainty. No drama, no flamboyant gestures, just a quiet confidence that immediately changed the entire atmosphere. The room turned towards her in unison. Every head snapped in her direction. Jasmine didn't need to say anything else. She moved toward the operating room without hesitation. Her orders were clear, precise, and needed no embellishment. Vitals, scans, and a team prepped with O2. She instructed without missing a beat, her voice sharp but steady. The words were simple, but in the chaos of the moment, they rang out like an anchor, providing the clarity everyone in the room needed. As she walked, the panic that had overtaken the room slowly began to shift. Nurses scrambled into action, the intern who had once sneered at her now urgently following her lead. The tension in the air dissolved as the staff began to work together, moving with a shared purpose under Jasmine's steady guidance. Within seconds, Jasmine had turned the tide from indecision to focused precision. Inside the operating room, the patient's heart was barely beating. The man, middle-aged and pale, was lying on the table, his vitals dropping fast. Jasmine's eyes scanned the monitor, her mind calculating each move as she scrubbed in swiftly, her hands moving with practiced familiarity. There was no time for hesitation now. The patient's heart was failing, and every moment counted. Vitals are crashing. BP 60/40ths and irregular. One of the anesthesiologists reported. We need to act fast. Jasmine nodded once, her gaze unwavering. Clamp the artery. Retractors here. Suction on the left. I need more exposure to the valve. Let's go now. Her commands were clear, concise, and everyone followed them instantly. There was no hesitation, no second-guessing. Her calm presence in the room made it clear. She was in control, and everyone had a role to play. The intern stood just outside the viewing window, his eyes wide behind his glasses, watching every movement Jasmine made. He'd never seen anyone work with such cool confidence, especially in the face of such a critical situation. Jasmine's hands were steady as she navigated the failing heart. Every incision, every suture, every move was made with precision. Her experience guided her. She had done this many times before, but this time, the pressure felt heavier. The lives of everyone in the room, the future of the patient, rested on her shoulders, but she didn't show it. Her hands moved as if they had done this hundreds of times before, and in many ways they had. BP is rising, the anesthesiologist reported. Jasmine didn't flinch. Her focus was solely on the patient, on keeping the team moving in harmony. She was in a rhythm, and everyone was following her lead. The intern, who had once dismissed her as part of the janitorial staff, stood in silent awe. He had expected a spectacle, a show of command, but instead, Jasmine's leadership was quiet, grounded in competence and skill. He watched as she seamlessly navigated the complex procedure, making decisions that could mean life or death. Minutes passed, though it felt like hours. Jasmine's calm voice continued to direct the team. Her every command met with swift execution. The room, once filled with uncertainty, now operated like a well-oiled machine. Jasmine's leadership had given everyone the confidence they needed to save the patient. Finally, the patient's heart began to stabilize. The monitor, which had been erratic moments before, now showed a steady rhythm. The team exhaled collectively, and for the first time, a sense of relief washed over the room. The immediate crisis was over. Jasmine stepped back, her breath steady but still measured. She removed her gloves, nodding once to the anesthesiologist. Keep him monitored in post-op. He'll need a full protocol, but he should stabilize. As the team began to prepare for the post-operative care, Jasmine took a moment to absorb the scene. The room that had once been filled with tension and uncertainty was now calm, the crisis averted. Jasmine didn't stay for the praise. That wasn't why she did what she did. She never needed the validation. Her eyes moved across the room, meeting the eyes of the intern who had watched her work. For the first time, the intern didn't look away. There was no smirk now, no arrogance. There was only respect. Before she left the operating room, Jasmine turned to the nurse who had mistaken her for a janitor earlier in the day. The nurse, who had looked at Jasmine as though she didn't belong, now met her gaze with something different, regret. Her eyes were wide with understanding. Jasmine didn't offer a lecture, and she didn't respond with anger. Instead, she gave the nurse a small, gentle nod. It's not your apology I need, Jasmine said softly. Next time, look at the name badge first. The nurse nodded in silence, and Jasmine left the room without another word. As she exited the operating theater, she could feel the weight of the situation lifting off her shoulders. Her work had spoken for itself. She didn't need to prove anything to anyone. The air in the hospital felt different as Jasmine made her way down the corridor. The cold, clinical atmosphere she had grown so accustomed to was now tinged with something else. An unspoken shift, an undercurrent of change. Her footsteps were still steady, her gaze focused, but the echoes of her earlier treatment were gone. No longer were there whispers, no more side glances or dismissive stares. The hospital, which had once made her feel invisible, now felt different. People noticed her, but not as a janitor, not as someone who didn't belong. She walked past the nurse's station, her presence no longer unnoticed. For the first time, the staff looked up and acknowledged her. Not with surprise, not with confusion, but with something else, respect. Doctors nodded as she passed, their eyes no longer averted. Nurses exchanged quiet murmurs, but this time, Jasmine wasn't the subject of their gossip. The voices were softer, warmer, and laced with understanding. The shift in how they perceived her was palpable. The interns who had once whispered behind her back were now the ones stepping aside, making space for her in the hallway. The smug intern who had earlier dismissed her as a cleaning staff member was nowhere to be seen, but Jasmine didn't look for him. She didn't need to. His absence spoke volumes. Jasmine had earned her place, not with words, not with protests, but with actions. Her work had spoken for her, and in doing so, it had elevated her position in this hospital. But it was a small, seemingly insignificant gesture that brought Jasmine the sense of validation she hadn't realized she needed. As she rounded the corner near the stairwell, she noticed an older black janitor pushing his cart down the hall. His face was lined with experience, his movements deliberate but slow. He had always been a quiet presence in the hospital, often invisible to the medical staff, much like Jasmine had been in the past. He was just another cog in the wheel of the hospital's daily grind, his work seemingly unnoticed by the people who walked its halls. But today was different. When the janitor saw Jasmine, he stopped. His eyes met hers across the hallway, and there was a brief pause, almost like the world had slowed down for just a second. The janitor's face softened, and then, without a word, he gave a small, deliberate nod. It wasn't a casual acknowledgement. It wasn't the kind of nod you give someone you barely know or someone you don't care about. It was a knowing nod, the kind given only when you truly see someone for who they are and what they've done. It was a silent recognition of her struggle, her accomplishments, and her resilience. Jasmine's heart stilled for a moment, her breath catching in her chest. The gesture was small, almost imperceptible to anyone else who might have been watching, but to Jasmine, it felt like the weight of the world had shifted. It was a moment of understanding, of solidarity, that she didn't realize she had been craving. She had spent so much of her career proving herself to those around her, fighting to be seen and heard in a system that often overlooked her. But in that brief exchange with the janitor, Jasmine realized that the validation she had been seeking wasn't going to come from the whispers of the doctors or the dismissive glances of the staff. It came from people who understood the truth of her position, the people who knew the weight of what it meant to exist in a world that tried to minimize you. The janitor didn't need to say anything. His nod was enough. Jasmine walked past him with a quiet smile, her chest swelling with an unfamiliar sense of peace. For the first time, she didn't feel the need to prove herself to anyone. The truth had been recognized, not by her colleagues in the surgeon's lounge, not by the medical staff who had once overlooked her, but by someone who knew what it was like to be invisible. And in that small, shared moment of recognition, Jasmine understood that she didn't need anyone's approval to know her worth. The nod from a janitor had said it all. The weight of judgment that had once lingered in every hallway, every glance, every room she entered, now seemed lighter. It hadn't been lifted by praise or accolades, but by the quiet acknowledgement of someone who saw her for who she truly was, a doctor, a leader, and a person deserving of respect. The hospital had always felt like a battleground to Jasmine, but now it felt different. It felt like a place where she belonged, where her presence was finally noticed, not just as an outsider, but as someone who had earned her place. As she continued walking, her head held high, the hospital didn't feel like an arena for judgment anymore. It felt like a space for growth, for respect, for understanding. Jasmine could feel the transformation within herself and within the hospital's walls. The shift had begun, and it was not just about how others viewed her. It was about how she now saw herself. And as she moved forward, she knew that, from this point on, the whispers would never be the same again. The news spread through the hospital like wildfire. Whispers that had once been laden with doubt and skepticism were now filled with a different tone, one of respect. Jasmine's name had quickly become a subject of conversation, but this time, it wasn't because of the way she was perceived or the judgments others had placed on her. This time, it was because of the impact she had made during the Code Blue, how her calm, unwavering leadership had saved a life when everyone else stood paralyzed by indecision. The staff who had once ignored her or dismissed her as out of place began to see her differently. The dismissive stares from the interns who had assumed she was just part of the cleaning crew were replaced with cautious acknowledgement. The doctors, who once murmured in the lounge about the janitorial staff in nice uniforms, now paused when she entered the room. Their whispers, which had once been judgmental, were now filled with curiosity and, most importantly, recognition. In the days that followed, Jasmine walked the hospital halls with a quiet confidence she hadn't had before. There were no more whispers behind her back, no more sideways glances. As she moved through the hospital, she didn't feel the weight of skepticism weighing on her. She no longer felt invisible. Doctors who had once never bothered to make eye contact now greeted her with nods of respect. Nurses who had previously bypassed her with hurried steps now stopped to ask for advice or brief her on cases. Jasmine didn't have to command respect. It was given freely, almost naturally. Her actions had spoken louder than any words ever could, and in the wake of the surgery, she had earned the respect she had always deserved. Her legacy was not born of confrontation or demanding acknowledgement. It wasn't a legacy of triumphing over the very people who had doubted her. Jasmine's legacy was born from her quiet resolve. Her ability to lead in the most challenging moments without drawing attention to herself. It was a legacy of competence, of being so good at what she did that no one could ignore her any longer. The transformation wasn't just in the way others saw her. It was also in how Jasmine saw herself. Before the surgery, she had been filled with doubt. She had been overlooked and dismissed, made to feel invisible by those who had judged her based on her appearance, her race, and her gender. But after the Code Blue, after leading the team to save a life under pressure, Jasmine finally saw her own worth. She no longer needed to seek validation from others. She knew who she was. She knew what she had accomplished, and that was enough. She wasn't here to prove herself anymore. Her competence was undeniable, and that was the only thing that mattered. Jasmine walked through the hospital halls with a newfound sense of peace. She didn't feel the need to rush to prove herself or to make a statement. The hospital had changed, but so had she. The confidence she had always carried silently now radiated through her every step. She was no longer just the woman in the hallway who was mistaken for a janitor. She was Dr. Jasmine Lee, a highly skilled cardiothoracic surgeon, and that fact was undeniable. In the break room, she overheard a conversation between two nurses. One of them was talking about the surgery that had taken place just a few days earlier. "Did you hear about Dr. Lee?" the nurse asked. "She saved that patient's life. She just took over the entire situation. No hesitation, no drama. She just knew exactly what to do." The second nurse nodded. "I heard. Everyone's talking about it. I don't think anyone expected it. But she was amazing." Jasmine smiled to herself. She didn't need the praise, but it felt good to hear her actions recognized. More importantly, it felt good to know that the respect she had fought for had finally been earned, not through words or fights, but through what she had done in the operating room. Later that day, as she passed through a quieter corridor, she caught sight of Dr. Halpern, the attending physician who had once looked at her with brief recognition but had stayed silent. He was standing by a patient's chart, his brow furrowed in concentration. When he saw Jasmine, he looked up and gave her a slight nod, something she hadn't expected but welcomed nonetheless. "Good work the other day," he said, his voice steady but sincere. You handled the surgery like a pro. Jasmine nodded, a quiet but grateful smile tugging at her lips. She didn't need to respond with anything grand. His words were enough. It was the acknowledgement she had long been waiting for, not from someone who had always seen her, but from someone who had once doubted her. As she walked away, Jasmine felt the weight of the moment settle within her. This was her new reality. Her actions had set a precedent, not just for her career, but for how the hospital would see her from here on out. She wasn't just a black female doctor anymore. She was a leader, a respected professional whose skill and competence could no longer be ignored. Jasmine's legacy was no longer about fighting for respect. It had been quietly earned through her expertise, her leadership, and her refusal to let anyone define her worth. And as she walked through the hospital once more, she knew that things would never be the same again. If this story touched your heart, like, share, subscribe, and turn on the notification bell for more powerful, soul-touching stories that restore faith in humanity.